I think we've all had that moment where we've realized that something about healthcare just isn't working. And it's often right when you need care the most. You might be trying to be proactive and get a doctor's appointment, and your only option is to take time out of your day, call multiple offices, find an in-network provider, and try to book an appointment. Or it might be that someone in your family is really sick and they need specialized care, and the next appointment is weeks, if not months away.
For me, it's just been so hard understanding my health benefits, and at times my doctor also does not understand them. So the burden is on me to interpret, coordinate, and make the judgment call when I need the care.
I think what really solidified this for me is seeing how healthcare works from the inside. After spending a decade building tools, and especially AI tools in healthcare, I realized that the devil is in the details. And it wasn't until I met Angelica and David that I truly understood how technology has failed patients and healthcare workers alike. We have personally been involved in building everything from complex risk stratification models for care gaps and closures to decision support tools for clinical pathways and discharge, to building one of the most sophisticated search engines for people to be able to find care.
But the tools available so far expect care coordination to be the same for everyone. The reality is, someone living in a large city like San Francisco or someone living in a small rural town have such different care needs. They might have a different insurance plan, or they might have different access to technology. So no matter how complex these tools are, they fail at interoperability. And you have to go back to basics, which is call, mail, and fax.
So everything works in their own bubble, but it all fails at some point because the whole system doesn't talk to each other. And that's why it's such a manual process to move step by step through the whole flow. And it shouldn't be the job of patients or doctors or nurses to take on all these laborious tasks.
And they don't have to because they have me, and I love talking to people and coordinating care.
Now, practices in health centers across the US will have someone on their phones at all times to take calls, to make calls, to answer questions, and to help people get care. And in multiple languages, that way we can meet people where they are.
And with David keeping an eye out on every patient when they need care, I know exactly how to reach them.
With Angelica and David together, we can finally experience technology that understands everyone, reaches out to people when they need care, and keeps the system going.
While the greatest minds are working on general intelligence for humanity, drug discovery, and building new diagnosis tools, within the coming year, Helpcare AI will solve the interoperability and care coordination problem with David and Angelica, so their work can reach the people, and doctors and nurses can finally hand off admin tasks and focus on patient care. Because at Helpcare, our mission is to improve the world's capacity for care, and we believe the time is now.